Omicron is just another variant of the COVID virus, just in the same way that Delta was. It is different in that it does seem to be much more transmissible than previous strains that we've seen, and that means it passes more easily from person to person. It does seem to cause less severe illness than strains that we've seen previously, and that's good news in terms of hospitalisations, and that's certainly what we've seen overseas, that even in countries with really high numbers in the community, such as we've seen in the UK, the percentage that actually end up having to go to hospital is really quite small. Symptoms are really similar to what we've seen before, so runny nose, scratchy throat, cough are the commonest symptoms, fatigue, and if you have any concerns, just get tested. That's the safest thing to do. It is likely that some chemotherapy units may start to be doing testing for patients before they come in for treatments, just to make sure that we're keeping the environment as safe as we can for everybody. Vaccine is really effective against Omicron. We think that with 3 doses for the general population, so the 2 primary doses and the booster, then the protection against severe infection is about 90%, which is really well worth having. If you haven't had your vaccinations yet, that's really important. You can have vaccinations when you're on chemotherapy. I normally advise my patients to have a dose of the vaccine just a couple of days before a cycle of chemotherapy, because that's when the immune system is likely to have recovered from the previous cycle. But if you have any doubts, then it's best to just talk with your treating doctor or nursing staff, and they'll let you know when is a safe time to have it done. Wearing masks and being very conscientious about that, and also conscious of good hand hygiene is really important. At the present time, I'm not saying to my patients that they shouldn't be going out and doing things that they want to do, but obviously as the community case numbers may rise, there may be different advice around that. I think the other thing that's kind of frightening around this time is what impact the surging cases in the community might have in terms of cancer treatments, if the staff absences or if the hospital's overwhelmed with cases. Hospitals have worked really hard to get good business continuity plans to make sure that that doesn't happen, that as far as possible we can continue to deliver the treatments that people need. So I'm really hopeful that we won't see a big impact in that.